I'm a Bloomberg Fellow.
I am a Bloomberg Fellow.
I'm a Bloomberg Fellow.
And I'm a Bloomberg Fellow.
I'm a Bloomberg Fellow.
And I'm a Bloomberg Fellow.
I'm a case manager for people living with hepatitis C.
Director of Suicide Prevention.
Historian and preservationist.
Detective with the Threat Response Unit.
An attending physician in the emergency department.
I work at the White House Office of National Drug Control Policy.
Bronx Connect.
Fort Lauderdale Police Department.
Get Healthy Philly.
The Hawaii Department of Health.
Food and Water Action.
I became a fellow to make sure addiction is seen as a disease.
I hope to do my part in ending youth homelessness.
I became a fellow to find new ways to address the effects of vacancy and abandonment.
I hope to reshape the food system to promote community and ecological health.
I became a fellow to strengthen primary prevention of human trafficking.
I hope to collaborate toward solutions that are bigger and smarter than what we are up against.
To promote social justice for people who use drugs in marginalized communities.
To promote mental health and decrease risk among minority youth.
To help reduce our nation's gun violence crisis.
To attack the true root causes of unhealthy environments.
Join us.
Join us
as we work to save lives.
And build a healthier future for our country.
And build a healthier future for our country.
Hello everyone, we're so excited that you're joining us today. For those of you who are watching our live stream and those who are seeing the recording on our YouTube channel, we're very excited to connect with you all today. Welcome to the Bloomberg American Health Initiative Bloomberg Fellows webinar series. Today, we'll be looking at the Environmental Challenges Focus Area. My name is Shane Bryan. I'm the Partnership and Engagement Officer with the initiative. Joined in studio today, I have my colleague, Faria Zaman, who is the Fellowship Officer here at the initiative as well.
Good afternoon, everybody. Hey, it's great to be here with you, Shane.
Thank you so much. We also have joining us online Leah Ford, Bloomberg Fellow, researcher with Food and Water Watch, Cheryl Bettigold, Director, Division of Chronic Disease and Injury Prevention with the Philadelphia Department of Health, and Jonathan Asani, faculty member here at the Johns Hopkins University Bloomberg School of Public Health. If you have any questions during the session today, please email in your questions to bloombergfellowsmph@jhu.edu. We'll be doing our best to answer all of your questions. For those of you whose questions aren't addressed during the session, we're going to email in and respond to all of the questions. So if any question that you have, please let us know. We look forward to seeing those and addressing them should time not allow for us to do so in the session today. So to give you a little bit of a sense of the session, we're going to talk about the background of the initiative, how we were founded, and how we got to where we are today. We'll talk about our focus areas, our cross-cutting themes, the approaches to our work. But we're going to focus a lot of the session on talking about the Bloomberg Fellows Program and the Environmental Challenges Focus Area. So to go back, the initiative was launched in 2016. This was when we saw 2 years of life expectancy decline here in the United States. And the thought leaders at the School of Public Health and Bloomberg Philanthropies identified 5 key areas to focus our energies to improve the health of the country. Those areas are addiction and overdose, adolescent health, obesity in the food system, environmental challenges, and violence. Now, it's important for you to understand that we take a very broad approach when we think of these 5 focus areas. So let's use violence as an example. We certainly are going to be looking at gun violence, intimate partner violence, but also community-based and structural systems that have created violence in communities. For today's session, we'll be talking about environmental challenges. And of course, we look at air quality and climate change, but of particular interest is how a community's built environment is affecting those who live in those communities. So we're going to talk about that a lot more today, and we look forward to sharing some exciting information with you all. Next, we have our cross-cutting themes. These are equity, evidence, and policy. These are issues that fall through all of the work of the initiative, be it either our Bloomberg Fellows program, or the work that our faculty does, or the way in which we reach out and engage with you all. So when we think of equity, we're thinking certainly about the lived experience of the individuals who are involved, either be it the Bloomberg Fellows, the faculty, or members of our initiative team. Thinking about race and ethnicity, and also thinking about the career trajectory that you've taken to get to where you are today. This is a very unique fellowship opportunity, and we want to use this opportunity to engage with individuals who haven't necessarily taken a traditional track to public health, but they can use the lens of public health to widen and deepen their impact in their communities. Now for evidence, it's all about the data, using rich data to inform our programs and our policies, ensuring that decision makers have data to back up the way in which they improve health in their communities. And finally, with policy, that's the national, state, and local level policies that affect the health of communities, but it also involves the organizational policies because that greatly affects the way in which you all engage and work with community. Next, we have our approach. For this, we do research, practice, and education. For research, it's shorter-term projects. We fund faculty to work with communities and organizations all across the country on impact-based projects, not necessarily looking at writing more research papers or getting more published articles. It's very important. But for us, it's more about the programs, the policies, opportunities to take a program that has worked in one community and transform it into a program for another community. Toolkits, all of those are opportunities for us to improve health, not just in one community with one research project, but across the country. For practice, this is an exciting opportunity for us to support 25 endowed faculty positions here at the school, 5 in each of the focus areas. These are individuals who are taking cutting-edge approach to their work, being innovative in the way in which they work with and collaborate with communities and organizations. These faculty support you as fellows and your organizations that you work for. And so it's exciting that we have the opportunity to bring those people into the school and support them and work with them through the practice approach of our work. Now, we know you all are logging on and joining us today to hear more about the Fellows Program. So we wanted to provide that background information to make sure you understood kind of where the initiative came from. But we want to get to the Fellows Program. So Faria, can you tell us a little bit more about the Bloomberg Fellows Program, what it means, and information folks should be aware of?
Absolutely, Shane. I'm very excited to tell you all about the Bloomberg Fellows Program. It's a unique type of scholarship program. It's impact-based, and we're looking for individuals who are working in any of the 5 focus areas here in the U.S. So fellows center their studies in their particular focus area. They engage with their organizations. And once they complete the MPH program, the fellows do what we call a service obligation, and that means working with your organization for at least a year. And the organizations are engaged through the initiative and the fellowship program, and all organizations are eligible to apply along with the applicant.
Awesome, that's great, Faria. And just to touch a little bit more on the National Network of Practice, these are the individuals and the organizations all across the country who are involved in the initiative. All Bloomberg Fellows and their employers, which we call collaborating organizations, join that network. It's an opportunity to collaborate with faculty, other organizations, our Bloomberg Fellows, on common issues, themes, or problems that you all are addressing. Now, we are looking for individuals both in the traditional, but particularly in the non-traditional public health field. Now, these are organizations maybe like urban planners or engineers. We have a librarian and lawyers who are a part of the program. We're really excited about bringing those backgrounds and those careers with public health practitioners using the lens of public health to address community needs. We also have an annual convening every year through the network called the Bloomberg American Health Summit. This is a unique opportunity for 2 days where we bring all the organizations, fellows, faculty, and thought leaders from across the country to dive deep into the issues of the 5 focus areas and project on where we can go into the future. So it's a very mutually beneficial opportunity, not just the fellow in the organization or the fellow in the school, but for all the fellows, the organizations, and the school to be working together in the 5 focus areas of the initiative. One of the most common questions that we get from folks as they're tuning in or interested in the program is, what's the difference between the full-time and the part-time program? So, Vari, can you dive a little bit deeper into that and tell us some of the differences?
Absolutely. So the fellowship is open to those individuals who would like to pursue both, either the full-time or the part-time. For full-time, you would be here in Baltimore for 11 months, taking classes between June and May, and the school has 5 8-week terms. And you would take, 1 to 3 courses if you are part-time, and if you're full-time, you'll take many more courses than that because you want to be able to complete it in that 11 months. For the part-time, as I mentioned, you could take 1 to 3 courses depending on your schedule and your workload, and our online courses are available from anywhere in the US, and the degree is almost entirely online, and it typically takes 2 to 3 years to complete the degree on a part-time basis, and the MPH program allows you to have up to 4 years to complete it if you need it. And again, it's 5 terms that are 8 weeks long.
Great. So that's good for folks to be able to know and hear more about the part-time and full-time opportunities. One of our fellows, Leah, who will be joining us in just a moment, can also tell you a little bit more. But I know that there's a lot of great courses that are available, Faria. Is that great?
Yes, we have so many courses. And since this webinar is about the environmental challenges focus area, I just want to share just a sample of the different types of courses that are available under the environmental challenges focus area. We have things from the built environment to climate change to environmental justice. And, students have a good number of electives that they can use, so you can really take any course you want. And as long as we're talking about courses, I'd like to introduce our amazing fellow, Leah Ford. Leah, thank you so much for being here with us today. We appreciate it.
Thank you so much for having me.
Yeah, so Leah, I think it would be interesting to start off just learning a little bit about the work that you're doing for Food and Water Watch.
Yeah, of course. So I'm a researcher here at Food and Water Watch, which means I write a lot. I write issue briefs, reports, different fact sheets on a variety of different environmental issues, including climate change, energy reliance, shifting our country off of fossil fuels and onto renewables, the threats of the oil and gas industry to our communities and health, and factory farming, to name a few. And our research is used to help organizing efforts that we have all across the United States and in Europe. We have offices across the country, and we also use our research to support different environmental legislation and policy that we're pushing through Congress. But for me personally, I'm really passionate about analyzing how these issues affect communities, and specifically the most vulnerable communities. And so I try to include an environmental justice component in each piece of research I write, because I know that every environmental issue has a heavier burden for those who are already marginalized. So that's a little bit about what I do here.
That sounds fantastic, Leah, and that's why you are a Bloomberg Fellow, because you're doing this amazing work. Listen, I know you're working full-time and you are a part-time student in the MPH program. How do you balance your full-time job and the courses that you're having to take every term?
Yeah, that's a great question. It's truly a delicate balancing act. I will say it looks different for everyone, but for me, one of the pieces of advices that we got during orientation that I took to heart was to ease into the program. You want to be able to establish your flexibility as a student, but also as a worker still, without putting too much on your job at work and also too much on your schoolwork. I love that aspect of being a part-time student, being able to deal with that flexibility. But so the advice that we were giving at orientation was to ease into it, meaning start with one course, which I think is critical in terms of figuring out what certain credits mean in terms of workload, how much time it takes you to get things done. Everyone's different. Everyone works at different paces. So I started with one 4-credit course, and then I gradually increased. So then I did 2 courses the next term. And I really, really like that because I got a better picture of how I can manage. And then also it just allows you to figure out what your boundaries are and what your limits are. For me, 7 credits max a term is about as much as I can do. And I found that out the easy way by just easing into my courses.
Thanks.
I would also say, as a part-time student, it's I think the most beneficial to take advantage of the institute. So that's the summer institute that's offered, and the winter institute. I actually had the chance to participate in the winter institute this past January, and I think it's a wonderful change of pace to be in person and to be around other students if you get the opportunity to do so. I feel pretty lucky. I was here in DC, and so I was able to go to a Hopkins building in DC, and I took a course, and it connected me with other students who were going to be in my classes the next term, and people who I've kept in touch with. So you're not completely siloed as a part-time student, is what I'm saying. There's plenty of opportunities to engage with faculty and also engage with other students, which I think is critical.
Leah, that is excellent advice and gives such a great picture to our audience here of what it's like to balance your part-time degree and your full-time job. One last question I have for you, Leah. So, you've been taking these courses for more than a year now, and can you talk a little bit about how or whether you are able to apply some of the skills that you're learning to your job?
Yes, I am. And I was actually pleasantly surprised. I'm actually currently in an epidemiology course, and we're learning how to interpret like population risk in regards to different health issues. And the concepts that we're learning in class, I'm seeing in the research studies that I use at my job. So I read and write a lot here as a researcher, and I'm constantly reading through studies. And so different concepts that we've learned in classes are in these studies, like odds ratio, relative risk, attributable risk. And I was pretty surprised, but pleasantly shocked because it's helped me understand how to interpret these studies. Like I actually know what an odds ratio is. So I know what this means in terms of the study. And it's pretty prevalent and I guess a lot of the work I do is health related. So it's pretty prevalent in a lot of the studies that I look at. And so I thought that was awesome. And I was like, this is very useful. And then also just in general, it's broadened my understanding of the issues that I'm passionate about and the different ways we can approach these different issues here at Food and Water Watch. And so I've talked to my boss about, including more qualitative research and the work that we do to sort of take different approaches to the work that we do, the issues that we have, and how we can expand our reach to reach more everyday people. And so I give that all thanks to the fellowship.
Thank you, Leah. Wow, that's fantastic to hear. Thank you so much.
Yeah, we're so happy to have you on, Leah. It's been great to hear about your experience, and I'm sure some of the questions that we'll get at the end of the session will maybe be directed with you. So we asked if you can to stay on and please chime in on any of the questions. Next, we have Cheryl Bedigal with the Philadelphia Department of Health. Cheryl, thank you so much for joining us today. And we could start off by maybe if you could just tell us a little bit about your work up in Philadelphia.
Sure, and it's a pleasure to be here with you all today. So I head up the Division of Chronic Disease and Injury Prevention in the Philadelphia Department of Public Health, and we focus on the most common drivers of early mortality and morbidity in the city. So that encompasses the risk factors for obesity, tobacco use, and now gun violence as the major cause of injuries in the city and deaths from violence. So, like many people doing this kind of work, we take a systems, environmental, and policy approach. So, that means we're basically trying to create a city in which it's easy for people to thrive and live healthy lives, and unhealthy choices are a little bit harder. So, what that looks like for the environmental focus, it's a little bit different from, I think, what's happening in some other places because we're not an environmental health division. Philadelphia, of course, has environmental health, but our fellow who works in the environmental challenges focus area is actually focused on walkability and livability. So, that means that she's partnering with community groups to try to think about what makes a neighborhood walkable. And that includes things like sidewalks and pedestrian countdown devices, making crossings easier, thinking about, benches and shade and things like that, but also thinking about violence, because when there's gun violence in a neighborhood, that is not either a walkable or a livable neighborhood by most people's definition. So it's kind of a cross-departmental, cross-divisional approach, and it's been really interesting for her to be at Hopkins and learn from the many experts and from her fellow students there.
Absolutely, and we're so excited to have Kelly as a Bloomberg Fellow and some others of your colleagues to be a part of the initiative. Now, Cheryl, you are actually one of our inaugural collaborating organizations, so we are so thrilled to have you and be able to share with the participants on this webinar. If you wouldn't mind just maybe sharing a few of the examples of how, as a collaborating organization, you've been able to be engaged in a part of the work.
Sure. And of course, the primary gain for us is the experience for our staff. I mean, there just is no better professional development ever. So, but in terms of like the involvement of the rest of the organization, the conferences that Hopkins has been holding for the Bloomberg program have been tremendous learning opportunities. So that is a really big and important piece. And the other piece in which this really extends to all of our staff is that our fellows, and we have been really lucky to have multiple fellows currently, when they go down for classes or what they're learning from their online classes, they're bringing that back. And we have a journal club, and they bring articles and share those with staff. And they also just share ideas when we're in a meeting, and they'll bring up something that came up with a faculty member or in a class that they're in. And the other piece of it is that on some of the initiatives that we're working on that are really very new for us, and we're really trying to figure out, what's, for example, an effective policy approach to gun violence. There are Hopkins faculty who have been involved through this fellowship who are helping us with that work directly. So from the organizational standpoint, it's just been a tremendous opportunity.
That's it's great to hear, and it's always exciting to find the different ways organizations have been able to engage through this network and with the initiative. The last thing I would just ask from you, Cheryl, is a very common question we get from applicants is, how can I sell this, or how can I get my organization to be on board? Would you have any suggestions or things you would like to share with the participants today about how organizations should be excited or looking for this opportunity?
Yeah, very happy to. Firstly, as I already mentioned, for professional development for staff, there simply isn't anything better out there. To be able to have staff participate in the MPH or the PhD programs at Hopkins, have that fully funded, and have that be part of something they do while fully employed with your organization, it just brings tremendous benefits. It also for us, we are lucky to have a staff with a lot of smart young employees who are going places. And so rather than have them, that going places, that advancement for them, rather than have that have to be leaving us and going somewhere else, this is a way for them to do that while still working for us. So they're able to expand their skill set, potentially move into different positions within the health department, and keep that learning here in Philadelphia. And then, of course, bringing lots of new ideas and resources into the division, whether it's an article they read or an idea that came up in class, something a professor said, bringing those ideas to our work is just tremendously beneficial. I think I just can't say enough good things about this program. It's just been such a fabulous opportunity for our staff. One of the other things is that for a lot of people, especially frontline staff working in public health, the Hopkins MPH, it's the gold standard program, and it's super expensive. And so we have a lot of people who wouldn't be able to do their MPH at Hopkins and might otherwise do a program that's local that might not be as strong. And so, the funding is a really critical piece for this. We're really grateful to be able to participate to the extent we have been.
Absolutely. Cheryl, thank you so very much. We greatly appreciate your insight and everything that you've been able to share with the participants today. And I know that you have a lot going on right now, so we won't hold you any longer, but we greatly appreciate you coming and joining us for this session, and we look forward to seeing you very soon. So thank you so very much. Next,
You're
folks.
very welcome. It's a pleasure.
Thank you. Next, we have Jonathan Asani, who's a faculty member here at the School of Public Health. Dr. Asani's departmental affiliations are within health policy and management, along with health behavior and society, and with the Whiting School of Engineering. His research focuses fall along the role of policies and technology on driver behavior and safety, effectiveness of distractive driving policies, autonomous vehicle testing, deployment, and how that can be used to advance safety and equity, and much more. So, Dr. Asani, we're greatly privileged to have you with us today. And if we could start off by you just sharing a little bit more about your work here at the school as it relates to the initiative and environmental challenges.
It's a pleasure to join you, and thank you for having me. So, as you mentioned, I started life as an injury prevention researcher, and working in the field of transportation, I quickly realized that transportation has, of course, an enormous burden of basically health and injuries as a result of crashes and collisions that occur on the roads today. However, transportation, when viewed through a public health lens, also has other impacts on health. Transportation can be thought of as a social determinant of health, in that your ability to get places, to get to your job, to get to a good school, even get essentials like the food and the medications we need, they're all facilitated by good access to transportation. So in a way, transportation is one of those conduits to better health. That kind of thinking has made me kind of reflect on my own role as a researcher and zoom out a little bit to think about how I can kind of view the transportation system through a public health lens and improve public health by optimizing the transportation system. That could include the use of new mobilities like autonomous vehicles, but it could also include much more simple fixes like providing access to transit, making environments more walkable, and improving kind of active living.
Yeah, thank you. Thank you so much. And you've touched on this quite a bit, and I know throughout this session, we've talked a lot about how within environmental challenges, we're thinking beyond climate. It's certainly a part of it. It's very important. We have lots of great fellows who are working in that realm. But Dr. Asani, can you talk about how we as practitioners in public health and just generally within society want to expand upon environment and environmental challenges beyond climate?
Most definitely. The built environment all around us is a big determinant of our health. So the built environment encompasses many things. It could include the home you live in, whether or not there's lead paint on your walls. It could include, as you've mentioned, the quality of the air that we're breathing in, because you might live downwind from a factory that's spewing out harmful chemicals. But it also has a lot to do with the transportation system and the networks that it connects us to. And we'd like to think of environmental challenges as encompassing all of these issues. Of course, the climate has to be a priority issue. It's a kind of such a big and difficult problem to solve that we have to keep our eye on it. However, everything, as you know, Shane, is linked. Our transportation system is responsible for an enormous amount of the emissions that are affecting our climate. And so if we look at these things kind of in their separate silos, we may miss opportunities to really make impactful public health change with interventions that could have multiple impacts across the board rather than having a singular approach.
Absolutely. And one really quick final question for you, Dr. Asani, is earlier in our session, I talked about how we have the 3 cross-cutting themes, and 2 of those, equity and policy, are things that you have worked in. Can you tell us a little bit about that work?
Most definitely. As I mentioned, transportation can be thought of as a social determinant of health. And unfortunately, Shane, as you know, many people who are already living in difficult circumstances are poorly served by the existing transportation system. And so how can we fix that? One example that I'd like to share with you today is a case study from our own city of Baltimore. We have a very progressive group of people working at the Department of Transportation there, and they've thought of a neat policy for the introduction of e-scooters in Baltimore City. They thought rather than allowing the companies to distribute their scooters anywhere they liked, they said, well, yes, you can make your money by distributing scooters in the busy areas where folks are going to want to use them in the downtown core, etc. However, as part of giving you permission to use scooters in Baltimore City, we're going to require you to distribute them in 20 areas in the city that are currently underserved by good public transit. And you're going to have to do this every morning. You're going to have four of your scooters in each of these zones. Otherwise, you won't get a permit. We love that approach because we see new mobility as an opportunity for us to right some of the wrongs in the existing transportation network and use it as a conduit to better access to so many things that we all need.
Wonderful. Thank you so very much. It's very interesting for us to hear and for you all to be able to tune in and hear more about this work. And that's just really a very small sample of some of the amazing things that are happening here at the School of Public Health and through the initiative. And we look forward to continue working with you all, the participants who are online today or watching our recording, to find more ways for us to think outside of the box and address some of the issues that you're facing in your community. So I know you're getting really excited. I know that just hearing from Leah and Cheryl and Jonathan about the work that they're doing is making you want to apply. So Faria, I think it's probably time for us to tell them how they can apply and what steps they need to go through.
Yes, it is. So I am excited to talk about applying to the fellowship and the MPH program. So you should apply to both the MPH and the fellowship at the same time. For the MPH program, please go to their website and you will have very explicit instructions on how to submit your admissions materials. The school uses SOPHIS, which is the name of the application processing system. So your transcripts, your letters, everything would be submitted through SOPHIS. You also have to apply to the fellowship. That means going to our website where you're going to find two forms, the organization form and the applicant form, and those can be downloaded and submitted right on our website. And the final deadline for applications is December 1st. And so everything has to be submitted by December 1st. You know, everything you need for your MPH admissions and your two fellowship forms, please be sure to submit it by December 1st. And what I like to tell everyone is please start early because the MPH program does require prerequisites and a GRE, and it's best to begin the process early so that everything is submitted on time.
Absolutely. And just for you all, we have another special announcement, a special video for you to see a couple of our inaugural fellows in the environmental focus areas in the field in their work. Enjoy this video.
Record heat waves here. Look at this.
2017 was the second hottest year on record.
We continue our weather teams look into the effects of bad air quality tonight.
We have a lot of very heavy industry, dirty energy, fossil fuel infrastructure in this area that is negatively impacting the community next to it.
Car-centric development, disinvestment in urban areas, air quality issues, water quality issues in a lot of communities make it difficult to make healthy choices for a lot of people.
With the help of the Bloomberg American Health Initiative, I'm working to gain a better understanding of outdoor air quality and how it relates to asthma and bring that to bear to address asthma and all of its multiple causes.
The Bloomberg American Health Initiative has provided me the skills and the tools that I can apply immediately to the work that I'm doing now. Investing into our streets and sidewalk infrastructure not only encourages physical activity, but also gets people out of their cars, which improves air quality and quality of life for everyone.
And it's a particulate matter sensor, so it's going to pick up the invisible fine particles in the air. Here at the asthma program, we do a lot of work to improve indoor air quality and asthma in homes and schools.
Cool. That's exciting.
Getting those firsthand experiences and hearing the stories of impacted community members is a really key first step to create change.
For people to be able to improve their lives gives me hope and motivation. It was really important that we as public health professionals learn to work with other folks to truly address these challenges.
That is such a fantastic video, isn't it, Shane? So I just want to let everyone know that both Kelly and Julian are part of the inaugural Bloomberg Fellows cohort, and they're both doing fantastic jobs. Shane, I think you have some questions.
All right, we do, Faria. We have some really great questions that you all have sent in. Just to let you know, there's more questions than we're going to have time to answer, so keep an eye out for an email response to those of you who are not able to get to your questions on air. But to start off with, Faria, we have a question here. It's been 10 years since this individual has taken any courses on a college campus. What should they know as they begin to prepare their application?
Okay, well, that's a great question. And I just want to let everyone know that many of our fellows have been out of school for 10 years, even 15, even 20 years, and that's totally fine. My advice is call the MPH program, talk to them, understand the admissions requirements. They have prerequisites, and they do require the GRE, so it's really important to start your GRE preparation early, take the exam early on, leaving enough time for you to prepare and so that your scores are submitted to the school on time. And also talk to the MPH program about their prerequisites, because they do require things like biology and math. And I think it varies applicant to applicant, so you want to find out what prerequisites you might need and to take those as well during the application process.
That's great. Dr. Asani, I think this question is actually going to be best for you to answer. We had a viewer email in that they currently work in the field of urban planning, and they are interested in the Bloomberg Fellows Program, and they're considering the environmental challenges as the focus area that they will apply into. They're just not quite sure if it's a good fit for them. Dr. Asani, I know you talked earlier about expanding our understanding of environmental challenges. Wondering if you can chime in here a little bit about how the field of urban planning or this particular individual is likely a really good fit.
Urban planners are some of the most powerful folks on the planet, I think, with respect to impacting health, and an underappreciated kind of element in the process of creating, designing, and kind of encouraging the development of healthy communities. Ideas, emerging ideas like complete streets, um, are the perfect example of the intersection of urban planning and public health. So while it seems like these two fields are poles apart, they are in fact, and we in fact share a lot of common goals and a lot of common language. So I would say, take your pen and smash the mental silos that we've all created around us, and definitely apply, because we need to increase the ranks of urban planners who are approaching their work with a public health lens.
What a powerful message. Thank you so much for sharing that. And those of you who are watching and tuning in, who come from that field and that background, we're looking for you. We want you to apply. We want you to be engaged in this initiative, and we look forward to seeing your applications. Now, this one, I think, Leah, you might actually have a good answer or some thoughts that you can provide. A number of the different questions that we've gotten in deal with the support that's available for students in Bloomberg Fellows. As one of the previous questions mentioned, folks who have been out of school for a while, or they haven't had a traditional public health background. So Leah, can you talk some about the supports that you've noticed and picked up on throughout your time as a student?
Yeah, for sure. I will say, in the courses, the staff, the professors, the TAs, they're extremely accommodating and extremely understanding. It's encouraged to ask questions, and they're here to answer and to be a resource for all of the students. And then it's also encouraged to interact with your fellow classmates on the discussion forums and to work through different concepts and different understandings. So I have found that to be extremely helpful. But also, the fellowship provides a unique opportunity to seek out tutoring. All the faculty in the fellowship program are extremely supportive, and they want to see us succeed in any way that it takes. And so if you all need a tutor for any kind of courses through the fellowship program, that is a resource that is readily available for any fellows, which I think is great. And then also in general, I think public health is such a cross-cutting sector that whatever background knowledge you bring in through whatever career type you've taken, I think it's relevant in any kind of sense, in a because there's a different array of topics that are covered in the program. And so I wouldn't feel too paranoid about, oh, I don't have a specific public health background, because neither did I. And I feel that everybody has knowledge and perspective to bring to the program.
Wonderful. Thank you so much, Leah. That's really great information to share. Fari, did you have anything else you would like to add about the supports or things that are available for fellows?
Well, just echoing what Leah has said, the fellowship is happy to provide fellows with academic support if you need it. A lot of people haven't taken courses like biostats in a long time, and sometimes you just need a little bit of support, and we're happy to provide that. All you need to do is ask.
All right, well, our next question comes in. This one's about organizations, Faria. We've talked about this a little bit, but just to make sure it's clear, are there any restrictions on the types of organizations that can apply for the fellowship program?
Absolutely not. We have a very wide range of organizations, ranging from federal agencies to small community-based organizations to hospitals, even public school systems and libraries. There are no restrictions for the organizations. As long as the organization is based here in the U.S., working in at least one of the 5 focus areas, everyone is eligible.
Wonderful. That's great to hear. And what about if someone applies into the program, but they don't get into the MPH program? Can you talk to us about what that means?
Sure. We encourage people to reapply. And in the past, we've had some applicants who did not get admitted the first time around, and then they spoke with the MPH program, and they'll be able to provide you really appropriate guidance on what you need to do to strengthen your application for the next time. And we've had applicants do that, and they've gotten in the second time around. So, don't give up and don't get discouraged. Try again, because it can work, and it has worked for several of our current fellows.
Great. And then another question, what are we looking for? What are you looking for in an applicant?
So we are looking for individuals that have a demonstrated track record working in any of the 5 focus areas, who are change agents, who are making changes in their communities and are motivated to continue doing that. We're looking for people who have a demonstrated commitment to their particular focus area and want to continue working in that focus area. We are also looking for organizations who are really strongly supportive of the applicant. And, we want that organization to tell us, what do they envision this person doing once they receive that MPH training. The support from the organization is just as important as what the applicant says in his or her application.
That's wonderful, Faria. And we thank you all for tuning in. Unfortunately, we are running out of time, but we know that you have some really great questions for us, and continue to send those in. Bloomberg Fellows, mph@jhu.edu. We'll continue to answer your questions offline and look forward to engaging and hearing more from you all. But there's one last thing. We want you to stay connected with us. So we have our weekly newsletter. It's called the American Health Dispatch. You can go on our website right now and subscribe. It comes out every Friday with wonderful resources and information that you can learn more on the 5 focus areas and the work that we're doing here at the initiative. Speaking of our website, go and explore. You can see information on some of the research projects that we've completed, toolkits that are available for you in your current work, and just a number of ways that you can learn more about the work here at the school and the initiative. Our YouTube page has over 100 wonderful resources, and you can go on and see some from our summits, our seminars that we've held here at the school, faculty talking about their work, and things that your community might be looking to implement. So go and check out the YouTube page and see some of the videos that are available there. Finally, on Twitter, we are very active and love engaging, so you go and follow us at American Health. We promise we'll follow you right back. So these are some of the wonderful ways that you can stay engaged and a part of our work already. We look forward to seeing your applications. They'll become available in August. Follow us online. They'll be on our website. We'll share it in our newsletter. And we look forward to seeing them come through, Faria.
That's right. So expect to see the release of our 2021 fellowship applications in and around the first week of August. And if you have any questions down the road, our emails are available. Please don't hesitate to reach out.
All right, everyone. Thank you so much for spending time with us today. We look forward to hearing you soon. Bye-bye.
Bye, everybody.